So hello, my name is Fardad. I'm a second year medical student here at McGill, and I'm here today to interview Dr. Karatsios, an infectious diseases specialist, on behalf of Medskl. So Medskl.com, that's for an online platform for the medical community to learn and thrive. So here we have Dr. Karatsios. Why don't you introduce yourself, please?
Good morning. My name is Dr. Christos Karatsios. I'm a pediatric infectious diseases specialist at the Montreal Children's Hospital, the McGill University Health Care Center, or the Glen site as we call it here in Montreal.
So we are doing this interview on March 9th, Monday.
Yes.
So last night, over the weekend, Italy just quarantined about 16 million people in northern Italy. So my question is, isn't the cat out of the bag already? Isn't this a pandemic? Is the purpose of these quarantines to maybe decrease the speed of spread, so the healthcare system can, I don't know what they can do in the meantime, but why are we putting people in quarantine?
Right. So I don't know how effective a quarantine is going to be. You could see that the quarantine in China didn't do anything. Well, maybe it may decrease the speed of the spread because people are not in close contact with each other. I'm hoping that, we don't have one of these springs that becomes winter all the way through April. And I'm hoping that the spring in the Northern Hemisphere comes quickly and it's warm so people can open up their windows, go outside a little bit more and be less crowded in with together. But, it's what Italy is doing is following what China did, quarantine people, because that gives them a chance to go and decontaminate surfaces. The city can decontaminate park benches. What's that going to do? I don't think it's going to stop the spread. It might slow it. That's all. It's just delaying the inevitable. You know what happened in Italy, though, right? This when you do a quarantine, you're not supposed to do this type of quarantine, because I know from firsthand that people heard that there was going to be a quarantine, so everybody took trains and buses and left for the south of Italy before the quarantine came into effect. So give it a few days and you're going to start hearing more cases in the south of Italy. And it's ridiculous. So now the question is, how effective is a quarantine? Well, not that effective, is it? Yeah.
So next question, a bit closer to home. How prepared do you think we are here in obviously Quebec and also in Canada as a whole and in North America? Let's just put everything together.
I mean, we have a pretty good healthcare system and we have pretty good infrastructure in place. But do you want to know the appeasing answer or do you want to know the real answer?
The truth.
The truth is we are not prepared for an outbreak or a pandemic, as this one is, of a severe respiratory illness where it requires hospitalization and ICU beds. We do not have the capacity. This year, unfortunately, we've also had a very bad influenza season. It is still going on. And there's still a lot of respiratory viruses out there. Pediatrics, I think, will be fine because the children are not they're not sicker than any other respiratory illness. It's the adult and the elderly that I more worry about. There's not enough ICU beds in North America to deal with this. If this turns out to be, if 10 to 15% of the population infected is going to be requiring in inpatient and maybe ICU care. There's estimates that 40-50% of the population of the world will be infected with this. Well, take 40 to 50, there's 7 billion people in the world, so that's 3.5 billion people that are potentially going to be infected, and take 10% severity rate of 3.5 billion. I don't even want to do the math. What are we at? 35 million or something like that? We don't have that. And you'll see the death rate go up. So, do I want to sound the alarm here? But you asked me that specific question, and I'm saying I don't know. We don't have that capacity to deal with something like this.
So we should be more vigilant, just take precautions.
More vigilant, try to take precautions and see if we can try to stop the spread. And I think that the WHO needs to get out there and call it a pandemic, so the markets crash, so people get panicked, but at least you have a coordinated response and you free money to go to places for the to fight this the spread of this virus.